Good morning, everyone. It's a bit more than morning. It's 10:33 here, and today we are going to learn about nervous system. Nervous system. We'll discuss about jerks and various, and we are going to discuss about the relations and their interpretation. Jerk. As it is just a review class, we can say it as a review class. We are not going to study details what is jerk or what. I hope you all know that, and we will just talk about the jerks, their root value, and what will be the consequences if there is relations in the nerve. And jerks, there are various jerks like upper limb and lower limb jerk, which you must know as a MBBS structure. Bicep jerks, tricep jerk, and supinator jerk. Bicep jerks, the root value of bicep jerk is C5, C6. If you want to say single, that's C5. And tricep jerk is C6 and C7. If you want to single, and it's C7. And supinator jerk, it's C6. So easy to remember: biceps, triceps, and supinator jerk. Biceps C5, triceps C7, and supinator C6. So biceps, upper forearm biceps C5.
That's and this is C5 biceps C5. There is C7 and C6, and behind there is C7. Then let's go to the lower limb. Lower limb, it's knee jerk, ankle jerk, and plantar jerk. The plantar reflex, we can say it's plantar reflex, a superficial reflex. It's root value knee jerk, it's L3, L4. Then come to ankle jerk, it's S1, S2. Then come to plantar, it's L5, S1, S2. Knee jerk, L3, L4. Ankle jerk, S1, S2. And plantar jerk, L5, S1, S2. Although I have written L3, 4, but while saying, you must say as L3, L4. Now let's go to upper motor neuron and lower motor neuron relations, that is nerve relations. It's simple to remember, like upper motor neuron relation, and lower motor nerve neuron relation. Lower motor neuron relation. Upper, up, high. Lower, low. So everything increases here as it is upper, up, and everything decreases here as it is lower, low. It's for your remembering, just for remembering. Okay. Now we can say that tone is hypertonic in upper motor neuron relations, and is hypertonic in lower motor relation. Hypertonic. Hyper means it becomes stiff. Its tone is increased means it is hard. It's stiff, and hypertonic is flaccid. Tone it's decrease, and hyper in lower motor neuron it's decrease. High, up, low, down. And deep reflexes. Deep reflexes are all these reflexes that we have discussed about, like bicep reflex, tricep reflex, supinator jerk, bicep jerk, tricep jerk, supinator jerk, knee jerk, and ankle jerk. These 5 are deep reflexes. This in upper motor neuron is exaggerated, means increased. If you do knee jerk, then it's exaggerated. Means it's you can say that it's more than the normal. That it uplifts its leg or her leg more than the normal, and it's diminished or absent in lower motor neuron relation. Plantar reflex, this is a superficial reflex, and it is in upper motor neuron relation. Plantar reflex is plantar extensor, hence up towards the body, and plantar reflex in lower motor neuron relation is plantar flexor, that's down. So paralysis, if there is no ablation, there is paralysis. And how? As tone is hypertonic, paralysis is spastic, means muscle is rigid, spastic. Then as it is flaccid in lower motor neuron relation, the paralysis is flaccid type of paralysis. and fasciculations are absent in upper motor neuron lesson and present in lower motor neuron lesson. So it's easy to remember: tone, deep reflex, deep jerk, plantar reflex, paralysis, fascial relations. Tone, deep, plantar, paralysis all increase. Tone hypertonic in upper. Deep reflex exaggerated. Plantar reflex, plantar extensor. Paralysis, spastic paralysis. It is increased. Now, fasciculation is absent in upper motor neuron lesion, and it's opposite in lower motor neuron lesion, as we have discussed. Now let's go what may be the causes of this upper motor neuron lesion. Then it's for MBBS level, you can know about only stroke. This you must know, other you can go through the books, standard books. Of exam point of view, and as a medical doctor, as a MBBS doctor, as an intern doctor, you can know about stroke and ICSO. ICSO stands for intracranial space occupying lesion. Stroke is a good topic and study. You can study it. And ICSO means intracranial space occupying lesions, and like brain hematoma, brain tumors, brain abscess, and let's go for lower motor neuron lesion causes. And this may be GBS, that is Guillain-Barré syndrome. It's poliomyelitis and peripheral neuropathy. If you know this much, and if you know good about this topic, it's more than enough for MBS student. So causes of upper motor neuron lesion is stroke, ICSO, like brain hematoma, brain tumor, brain abscess, and causes of lower motor neuron lesion is GBS, that is Guillain-Barré syndrome, poliomyelitis, peripheral neuropathy. Now let's see some of the complaints that may patient present during the visit to you. Or they can complain of headache, vertigo, tremor, unconsciousness, plagia or paralysis, or weakness, fever, convulsion, neck rigidity, hypertension. These are some complaints, and you must know all of this in quite details, so that you can deal with the patient in your internship or as a medical doctor. Now we can go for examination. This examination was done a bit earlier, but this I present some pictures here to make you a bit more clear. So in every examination, as we know that, we should stand on the right side of the patient. First, you should introduce yourself, like I'm doctor, I'm a medical student from 5th year, and I want to examine you, and there's no any problem to you, there won't be any problem to you. If there's any problem, then you can just tell to me. If you get any questions, then you can ask to me, and you should take consent. May I proceed? Then if the patient gives you permission, then you can go for your examination. Then you can do your examination that we are going to do, that is jerk. For bicep jerk, as shown in the picture, rest the patient's arm on your arm, like this would be in here, this side. Here, rest the patient arm in your arm, then put your finger on the biceps tendon, and as you are seeing here, strike with the opposite side of the hammer, and look to the biceps muscle. As was just as a demonstration, so it has not exposed, but when you do the biceps, just expose up to your arm, expose the arm, so you can see the biceps muscles here, and you can see the jerk. For triceps jerk, place the hand of the patient as shown in the figure, so that the triceps tendon can be exposed. Here also exposure is not done. You should expose the arm of the patient. Then strike directly with the hammer here. Here in biceps jerk, we have put our finger over the biceps tendon, then we have striked. But so we are going to proceed for the jerk. So first of all, expose the arm of the patient so that the biceps muscle can be seen. Then place the patient's arm on your left arm, so it gets relaxed. Then place your finger over the biceps tendon and then strike with the hammer on your finger and see over the biceps muscle to see the jerk. Then we will go for triceps jerk. Place the hand as shown in the picture, but here also you should expose the arm so that the triceps muscles can be seen. You should always strike with your right arm as you are right-handed. Place your left arm as shown in the figure and strike directly over the triceps tendon. And to repeat for the another arm too, and in bicep jerk too. Then supinator jerk. For supinator jerk, again exposure is not done here. You must expose up to this your forearm so that supinator muscles can be seen. Then place the patient arm as shown in the figure. Place your arm as left arm as shown here and strike with the hammer the supinator tendon, that is along the radial end of the arm above the carpal bones, side of the carpal bones. Not carpal bones are here, it's here, so you should strike here. Then we'll go for the lizard. So also just tell the patient to put the arms like this. One leg is straight, another is flexed, and set to relax on your left arm and strike directly with the hammer on the patellar tendon. And you should see over the quadriceps muscle. So the proper exposure should be done in the thigh. That is, lower extremity should be exposed properly. Now we will go for the ankle jerk. Then we will go for the ankle jerk. The leg is also flexed, one leg is straight, another is flexed as shown in the figure, and here also it is made taut so that the tendon becomes prominent, so that this tendon, which is the Achilles tendon, is prominent, and you directly strike over here and see the hamstring muscles. And do the same for the next as shown in the figure. It's not figure, it's picture actually. Now we will go for plantar response. Yeah, plantar reflex. It's a superficial reflex. Place sense lower extremity straight. Then place your left arm like this, just above the ankle joint. Then put your fuse key and just make a stretch in this way. Like you start from here like this, start from here and like this, you start from here and like this. You come from heel straight above, then round to the tip, not to the tip but just below the get toe, from heel to just below the get toe in the foot. Do same for the both the legs. And it's here interpretation. Its interpretation is same. If the reflexes are exaggerated, it's upper motor neuron, and if it's reduced, it's lower motor neuron, and its causes are stroke, ixol, like ventricular abscesses and so on, and multiple sclerosis. So SIM, upper motor neuron lesion, SIM, SIM at the rate SIM. So it's SIM, SIM, SIM. As for stroke, I for ixol, that is brain tumors, brain abscess, and then M for multiple sclerosis. And if these are absent, then it's lower motor neuron lesion, GBS, polymyelitis, and peripheral neuropathy. So it's a brief on reflexes and its interpretation. Thank you everyone. Hope you liked this video and improve a lot. Here we need your support, so do subscribe the channel. Thank you.